So the purpose of the grant is really to train future psychologists to be more competent in providing mental health and opioid use disorder related care to patients as part of a multidisciplinary team. So in our case, the grant will provide training for the psychology students in integrated primary care settings, also in specialty care settings, in clinics like PORT, which focuses on opioid use and substance use treatment, and then also in a variety of other settings like some rural primary care clinics, also a little bit at the Greenville Homeless Shelter medical clinic, and then also some training for our community's first responders too. So the grant is actually a partnership with the Department of Psychology and the Department of Family Medicine. The Department of Psychology has a doctoral program in clinical health psychology to train future psychologists, and by partnering with us at the Department of Family Medicine, we can place those students into the training settings to get the training that they need to be able to provide those services in the future. It is paramount, especially right now. So it's becoming more and more common for behavioral health providers like psychologists to be present in medical settings, to be able to kind of meet patients where they are in the medical settings. And the neat thing about this grant is that it layers on opioid use disorder training in a way that we haven't necessarily done before. So we're recognizing that the opioid crisis is real, and that if we're going to address it, we have to find ways to meet people where they are. We have to show up where they're showing up in medical settings like primary care and in other treatment settings to really make an impact. The grant is funded by HRSA, and HRSA is an organization that is really focused on kind of closing the gap for rural healthcare. So training and researching strategies that will help provide better care for people in rural places throughout the country, including Eastern North Carolina. So the doctoral psychology students will get to participate in a number of different rotations during the one-year training program. So they will get to provide behavioral health services in the family medicine clinic. They will also get to train and work over at PORT, where they will be providing more specific substance use related treatment. They will get to provide some training for first responders in our community. They'll get to work with patients at the Greenville Homeless Shelter Clinic. And we are still working on a few more partnerships that we might be able to give them some opportunities with more rural health and even with telehealth through our family medicine clinic to work with patients in more rural settings that we otherwise don't work with and don't have access to behavioral health care and substance use related services. So that's really important and exciting for our students to be able to graduate with the skills that they need to be able to help patients with those things.